Okay, room check. And then my papers, blank paper. MAR, provider order. And then my drug cards. Hello, my name is Jenna. I'm the nurse today. Can you please verify your name and date of birth?
Madison Schneider, 5/14/05.
Wristband. And provide privacy. Today I'm going to be giving you your medications. Are you in any pain today?
No.
Okay. Are you comfortable?
Yep.
Okay. So I'm going to go get your daily medications and I will be back if you're comfortable and okay until I get back.
Yep.
Okay. So now I come over here and she's not in any pain, so I will be giving digoxin 0.125 milligrams PO for CHF atrial fib for Joe Smith. I will be giving Lasix 40 milligrams PO. He gets that twice daily for CHF. And for both of those medications between 7 and 3, so I'll be giving that for the first time today. I will be giving warfarin 5 milligrams PO. He gets that daily for atrial fibrillation. That has not been given yet for Joe Smith, and he's not in any pain, so I will not be giving any pain medications. And we'll just make sure they compare. So digoxin 0.125 milligrams PO daily for CHF atrial fib, Lasix 40 milligrams CHF twice daily, and Coumadin 5 milligrams daily for atrial fib. And we will not need any pain medications. So now I will put the provider order away and I will dump that, Lasix and warfarin. Okay. So for nursing considerations for digoxin is assess apical pulse, monitor electrolytes, monitor ECG, and beers avoid dosage greater than 0.125 milligrams. And okay, so then Lasix, assess fluid volume status, assess blood pressure before and during therapy, lying and standing, otoxicity, assess for tinnitus, hearing loss and ear pain, and hypokalemia, acidic urine, reduced urine osmolality, and warfarin, monitor blood studies, INR in hospital after second or third dose, assess for bleeding gums, black tarry stools, hematuria, and fatal hemorrhage, and monitor blood pressure and watch for increasing signs of hypertension, and assess for fever, skin, and a skin rash. And digoxin level is 2.1 and the toxic level is 2.4, so I will be able to give that today. Okay, so now I'm going to do the first med check. My med cup's here, and I will first I'm going to do digoxin 0.125 0.125 milligrams. Okay, so here I have digoxin for Joe Smith. This is 0.25 milligrams and I need 0.125 milligrams, so I will split it in half. It is a tablet, so we will be giving it PO daily between 7 and 3, so I'll be giving that for the first time today. For CHF and atrial fib, the expiration date is 4/04 of 2041, so it is not expired and the packaging is good and intact. And then I will be giving Lasix 40 milligrams. So we will be doing so here I have 40 milligrams of Lasix, 20 milligrams each for Joe Smith. He gets it twice daily. He has not had it today, so his first one is due between 7 and 3 for CHF. He gets that PO, and the expiration date is 04 of 2041, and the packaging is good and intact. And then we will do Coumadin, warfarin next. Oops. So here I have a 5 milligram tablet, so we'll get that PO. Gets it daily between 7 and 3, so we'll be administering that for the first time today. For atrial fibrillation for Joe Smith, the expiration date is 12/31 of 2034 and the packaging is good and intact. Now I will do, and I did not need to split or crush any of these except for digoxin. Now I will do my second med administration. So I have warfarin here for Joe Smith, 5 milligram tablets. He will be getting that PO. He gets it daily between 7 and 3, so we'll be giving him his first dose. For atrial fibrillation, the expiration date is 12/31 of 2034, so I'm going to put that in my cup. And then I have Lasix, 40 milligrams, 20 milligrams each, tablets, so it's going to be given PO. He gets it twice daily between 7 and 3 for his first one for CHF. For Joe Smith, the expiration date is 04 of 2041 and the packaging is good and intact. And then I have digoxin, 0.25 milligrams, but I will crush it or split it in half, so it is 0.125 milligrams. It's a tablet, so it's going to be given PO. He gets it daily between 7 and 3 for the first dose, or he gets it one time, so we'll be giving that between 7 and 3 for CHF and atrial fib. Okay, now we will gather all my stuff and enter the room. Knock, knock, knock. Hello.
Hi.
My name's Jenna. I am the nurse today. Can you please verify your name and date of birth?
Madison Schneider, 5/14/05.
Okay. Look at your wristband. And I'm going to clean my hands and provide privacy. Do you have any allergies I should be aware about?
Sulfa and betadine.
Okay. And I don't feel the need to wear gloves or PPE. Today I have your medication here for the day and you can take it orally, correct?
Yep.
Okay. So first I'm going to just go through the medications with you and then we will administer the medications.
Okay.
The first time I did the elevator speech, I can't remember if I did allergies, so I would do allergies. Alright, so now, are you comfortable?
Yep.
Okay. I'm just going to scan your wristband here. And then go through. Okay, so now I'm going to do my third med check. So I have Digoxin 0.25 milligrams, but I need 0.125 milligrams, so I would split it. And I already did that. PO, and he gets it daily for CHF, atrial fibrillation. So I'm giving that to you for the first time today, and it's due between 7 and 3. Okay. And then I have 40 milligrams here for you of Lasix. You get that twice daily, so we'll be giving that to you for the first time today, and it's the first dose is due between 7 and 3. And you get that PO, so these are tablets for CHF for Joe Smith. And then lastly here we have warfarin for you, 5 milligram tablet PO. You get that daily, so we'll be giving that to you for the first time for atrial fibrillation. And it's good. So now I'm just going to go through and scan the medications. So this is warfarin 5 milligrams. Lasix, we have 20 milligrams and 20 milligrams, so 40 together. And then we have Digoxin, 0.125 milligrams. Do you have any concerns?
No. Okay.
Alright, so warfarin is used for atrial fibrillation. Common side effects we see are nausea, cramps, rash, and fevers, and then adverse side effects which are more life-threatening, hematuria, calciphylaxis, and hemorrhage. Can you teach back what this is used for?
Atrial fibrillation.
Okay, and just a side effect?
Fever.
Okay. And then next we have Lasix. It is used for CHF, so that's why we'll be giving that to you. Common side effects are headaches, fatigue, and weakness or vertigo. Adverse side effects is circulatory collapse, loss of hearing, and hypokalemia. Can you teach back what that's used for?
CHF, and then a side effect is a headache.
Okay. And then next we have Digoxin. That is for CHF and atrial fibrillation. Common side effects are headaches, drowsiness, confusion, disorientation, fatigue. Adverse side effects are dysrhythmias and AV block. Can you teach back what that's used for?
CHF and atrial fibrillation.
And then a common side effect?
Fatigue.
Okay. So do you have any concerns before we give you your medication today?
No.
Okay. So here's that for you.
Thank you.
And here's some water.
Thank you.
Right now I'll stay with you until that is swallowed. Okay. not to withhold any medications other than your pain meds because you were not in pain. I would document here my med administration. So I would do that. This came at 12:30. And then, if you had adverse side effects, we would not give you any more further medication. We would assess you and your vital signs. I would contact the pharmacist and your provider, and I would document per agency policy. And I will be back to assess you in 30 minutes.
Okay.
Do you have any questions or anything?
Okay.
So documented, and then if you don't have any questions or concerns, I will get out of your way. We'll just make sure your side rails are up, you're in a comfortable position, okay? Make sure your bed is low and locked. And make sure you have your call light within reach. And make sure your side table is within reach, and I would make sure the room is risk-free of falls. And then I will do hand sanitizer, and the 5 stages of hand hygiene are before a patient, after a patient, after a procedure, if you touch patient belongings, and if your hands come in contact with bodily fluids. And you don't have any concerns or need anything before I
Nope.
begin? Okay, I'm just going to go document now, and you have a good rest of your day.
Thank you very much. You too.
Okay, now I'm going to think if there's anything I missed quick.